So if you stay calm with the 911 communicator, it's much easier and faster to get help. Agencies that provide CPR curriculum are the American Red Cross and the American Heart Association. Typically, most facilities want you to have American Heart. You must be trained to administer CPR unless you are doing hands-only compressions. Activate the emergency medical system or your facility's plan. CPR must be started immediately to be effective. Follow the facility policy for advanced care directives. So if your patient's a DNR, do not start CPR. Methods to administer CPR: there is one-person CPR and two-person CPR. Convulsive disorders: there are many causes that could be from an infectious disease, medication that wasn't given, a head injury, a stroke, or seizure syndrome. Types of seizures are partial, general, or unclassified. A general seizure can be a grand mal or a petit mal, which is an absent seizure. What you need to do is summon help, stay with the resident, protect them from injury by lowering them to the floor, remove objects out of the way that may cause them injury. Do not restrain them or put anything in their mouth. If you can, loosen constrictive clothing specifically around their neck, place a pillow under their head, and turn their face to one side in case they vomit. Note the time and type of seizure. Provide rest for the resident after the seizure. They are very tired, confused, and often they're disoriented. So if someone faints, fainting is caused by temporary reduction of blood to the brain. Early signs and symptoms include dizziness, decreased pulse and blood pressure, pallor and perspiration, nausea, cold skin, numbness, and tingling of the extremities. Make sure you summon help, stay with the resident, have them sit or lie down, loosen tight clothing, position the head lower than the heart. Sitting, they can put their head between their legs, or lying down, elevate the legs. Monitor pulse and respirations and have the resident rest for 5 to 10 minutes before moving. Once you get them moving again, have them move slowly. Provide a blanket if they're cold. Causes of shock can be from severe injury, excessive loss of body fluids, pain, respiratory and or cardiac arrest, anxiety, low or falling blood pressure, weak, rapid pulse, cold, moist, pale skin, rapid respirations. Patients also have thirst, they're restless, they're confused, and oftentimes they have a loss of consciousness. What do? Summon help, stay with them, keep them laying down, control any bleeding if they have it, and keep them warm. So hemorrhage, there are two types, internal and external. Signs and symptoms of internal: pain, shock, which we just talked about, vomiting blood. This does not mean a little strand of blood when they cough. This means big clumps. Loss of consciousness. External can usually be seen. Internal, you need to summon help, stay with them, keep them warm, flat, and quiet until help gets there. External hemorrhage: summon help, stay with the resident, identify the location of the bleeding, and apply continuous direct pressure. If bleeding is not controlled, apply pressure over the artery above the bleeding site. If no pain or broken bones, elevate the wounded area above the heart while maintaining pressure. With external hemorrhage, keep the resident comfortable, warm, and quiet until help arrives. When you report an emergency, make sure you never panic and stay calm. Take a few slow, deep breaths, observe your surroundings, assess your resources that are available, evaluate your situation, such as the victim, the safety of the environment, call or send for help, and determine treatment priorities. Report emergencies accurately. If help is not available, contact 911, the police, the fire department, the telephone operator, or local EMS. You make sure you report accurately by saying your name, the location, the description of the scene, information about injuries, the type of help that's needed, and the number of people that need your help. Know your limitations, provide care and reassure victims, and keep bystanders away from victims. And this ends 3.02, Understanding Safety and Emergency Care Skills within the Nurse Aid Range of Function. So Unit 4.01 is understanding vital signs, height, and weight measurement skills. So some of this is a repeat. So 4.01 introduces skill need to measure and record the resident's vital signs, height, and weight. So vital signs provide information about changes in the normal body function and the resident's responses to treatment. Often the first sign that there's a problem is a change in vital signs. Vital signs are temperature, pulse, respirations, plus blood pressure. So vital signs reflect the function of 3 body processes that are essential for life: regulation of body temperature, heart function, and breathing. The abbreviations for those vital signs are T for temperature, P for pulse, R for respiration, and BP for blood pressure. So the purpose of vital signs are measured to detect any changes in normal body function, and it's used to determine responses to treatment. So let's talk about temperature. So we get a temperature through heat production that can come from your muscles, your glands, or oxidation of your food. We get heat loss through respiration, perspiration, and excretion. The balance between heat production and heat loss is body temperature. Factors that affect your temperature include exercise, illness, age, time of day, medications, infection, emotions, hydration, clothing, environmental temperature, and air movement. So the instrument used to measure body temperature are the oral thermometer, a rectal thermometer, and they are non-mercury and they are made of glass. Chemically treated paper, which is disposable, plastic disposable thermometers, electronic with a probe covered with a disposable shield, and tympanic, electronic probe used in the ear. This is a picture of an electronic thermometer, and it can be used for oral, rectal, or axillary. Axillary means in the armpit. Axilla is armpit. The red probe is used for oral temperature. The blue probe is used for oral temperature, and the red probe is used for rectal. We use disposable probe covers to prevent cross-contamination between patients. The oral or tympanic, and that's oral with an AU, tympanic temperature is taken in the ear. It measures the thermal infrared energy radiating from the blood vessels in the eardrum. That's how you get the number. It can be affected by position and earwax. It is left in the ear until it beeps. The temperature is calculated into an equivalent by modes. Infants under 1 year, you need to pull the pinna of the ear straight back. That is the position. Infants that are over a year and adults, the ear pinna goes straight back and is pulled down. Positioning the pinna correctly straightens the auditory canal so the probe will point directly at the tympanic membrane. Remember, it measures off of infrared heat off of those blood vessels. So make sure you pull the ear pinna straight back and down. These are the way thermometers look. So the top of the thermometer, which is here, is the bulb, and here, and here. This is called the stem. These are different types of clinical thermometers. If you look, the oral thermometer has a longer bulb, where a security or a rectal thermometer has a shorter bulb. When you place an oral thermometer, you need to make sure that you put the bulb tip of the thermometer in what we call the hot pocket under the tongue. Most of you know that you have a frenulum underneath your tongue, and a lot of times your parents will just kind of stick it in your mouth. You need to make sure that you get all the way to the back down by the molars. Normal temperature ranges for adults. Oral temperatures are 97.6 degrees Fahrenheit to 99.6 degrees Fahrenheit. Rectal is 98.6 to 100.6, and axillary is 96.6 to 98.6. So an interesting way to learn this is called Tic-Tac-Know, the normal range for adult temperature. So if you put 98.6 in the free space, if you look at the numbers on 2 slides back, you can see that 98.6 is the one that stands out as the average of all temperatures. So that's the average oral temperature for adults, and it falls in the middle of the normal range. 1 degree to 98.6, then place results in the oral space to the right. And if you go subtract 1 from 98.6, place the result in the oral space to the left. The average adult temperature taken orally, the range is 97.6 to 98.6, with the average range being 98.6. When you think about rectal temperatures, body heat registers 1 degree normal when the temperature is taken rectally. So you write it, as you can tell, when you write a rectal temperature with an R and a circle to let the practitioner know that this temperature was taken rectally. So how do you fill in the blocks? You add 1 degree to the 98.6 and place the results in the space below. Makes it 99.6. Add 1 degree to 99.6 to place the results in the rectal space to the right. And of course we subtract 1 degree and place it to the left. So we now have oral and rectal temperatures. The average adult temperature taken rectally is 99.6. The range is 98.6 to 100.6. So when we think about axillary or groin, body heat registers 1 degree cooler when the temperature is taken axillary or in the groin. Subtract 1 degree from the average temperature of 98.6, gives you 97.6, and you place the results in the space above. Then we're going to also add 1 degree to the 97.6 and place it to the right. And then we're going to subtract 1 degree and place it to the left. So you have to record the location where the temperature was given. Temperature was taken in order to interpret what's normal versus abnormal. So if you look alphabetically, axillary or groin, AG, next is oral, next is rectal. If you put 98.6 in your center free space and you add 1 always to the right, and you subtract 1 always to the left, and you subtract 1 if you go above, and you add 1 if you go to the bottom, that gives you ranges of temperature. So when you write a temperature, if you do it in the axillary, you need to write A or X. You don't need to put anything for oral, because if you put no location, it is assumed that it's oral, and R for rectal. How do you read that thermometer? You need to hold it at eye level, locate the solid column of liquid in the glass, observe the lines on scale at the upper side of the column of the liquid of glass. Read at the point where the liquid ends. If the liquid falls between 2 lines, read it to the closest line. A long line represents 1 degree. A short line represents 0.2 of a degree Fahrenheit. So when you look at a thermometer, the long lines are 1 degree. The shorter lines are 0.2. So when you look at this particular picture of a thermometer, you can see 96, 97, and 98. So we're going to read where the line ends. So that would put it at 98.6. So oral site is the most common. The rectal registers 1 degree Fahrenheit higher than oral. Axillary usually registers 1 degree Fahrenheit lower. And the tympanic, of course, is the probe inserted into the ear canal. It's best to take temperature when the patient is at rest. And we have to figure out the condition of the patient or resident and which is the best site for measuring body temperature. Some safety precautions. Hold the rectal and axillary thermometers in place. If your resident or patient is able to hold the oral thermometer, you may allow them to do that. If they are unable, you need to assist them. You need to make sure when you're taking a temperature that you stay with the person at all times. Check the glass thermometers for any chips, and prior to use, make sure you shake the liquid in the glass all the way down. Shake the thermometer away from a resident or hard objects. Glass thermometers will break. When we clean, we need to make sure that we wipe from the handle end toward the bulb tip of the thermometer prior to reading. Delay taking oral temperatures for 10 to 15 minutes if your resident has been smoking, eating, or drinking hot and cold liquids. So some conditions of temperature: hyperthermia. Hyper is increased or elevated. Thermia is body temperature. That is body temperatures greater than 104 degrees, and temperatures greater than 106 will cause convulsions and possibly death. Fevers are technically considered temperatures over 101 degrees Fahrenheit rectally. Typically, they're due to a disease or an illness. Hypothermia, body temperatures below 96 degrees, due to cold exposure and cold temperatures, and it depends on core temperature, age, and length of exposure. Now let's talk about pulse. So pulse is measuring the one way of checking on the circulatory system. So circulation is continuous movement of blood throughout your body. That is what makes you alive. Functions of the circulatory system: the arteries carry blood with oxygen and nutrients away from the heart to the cells. They are notated here in red. Those are your arteries. Veins carry waste products away from the cells and to the heart. The adult has 5 to 6 liters of blood circulating all the time. Your blood consists of 90% what we like to call water, which is called plasma, blood cells, carbon dioxide and oxygen, nutrients, hormones and enzymes, and of course waste products. Types of blood cells: red blood cells called erythrocytes carry oxygen from blood to the cells. White blood cells called leukocytes are there to fight infection. Platelets are called thrombocytes, and they're required for clotting to stop bleeding. The arteries carry blood away from the heart, and again, veins carry blood to the heart. The heart is a tissue with 3 layers. The tissue has 3 layers, The endocardium is a smooth inner layer. The myocardium is the thick, muscular middle layer. And the pericardium is the double-walled membrane that covers the outside of the heart. The heart is divided into the right and left side. The atria are the upper chambers where blood is received, and the ventricles are the lower chambers that pump blood to the lungs and the body. You have 4 chambers. Number 1 is the right atrium. It receives blood from 2 large veins: the superior vena cava and the inferior vena cava. The right ventricle receives blood from the right atrium and pumps it to the lungs through the pulmonary artery. The left atrium receives oxygenated blood from the left and right pulmonary veins. The left ventricle pumps blood to the aorta. That would be the ascending aorta, which delivers blood to all of the body parts with the exception of the lungs. Located at the entrance and exit of each ventricle, we have 4 heart valves. You learn that in Health Science 1. So the heartbeat consists of systole, which is the contraction of heart muscle, and diastole, which is the relaxation of the heart muscle. Blood pressure is the highest and lowest pressure against the walls of the blood vessels as the heart contracts and relaxes. The pulse is the expansion and contraction of the artery. Some common disorders of the circulatory system are arteriosclerosis, which is where the walls of the arteries become thick and harden. Hypertension is high blood pressure. Peripheral vascular disease is a decrease in flow of blood to the extremities and the brain, also called PVD. Angina pectoris is chest pain. Varicose veins are enlarged, twisted veins that usually happen in the legs. Pregnant women a lot of times will see this because their body is now circulating blood for two. Congestive heart failure is circulatory congestion caused by weak pumping of the heart muscle. And myocardial infarction, a heart attack due to the blockage in the coronary arteries. Anemia is a low red blood cell count. A thrombus is a blood clot. Phlebitis is inflammation of a vein. Atherosclerosis is fatty deposits on walls of arteries that reduce blood flow. So as we age, the heart muscle becomes less efficient. Blood is pumped with less force. Arteries lose their elasticity and become narrow. Blood pressure increases. Blood chemistry is less efficient, and our capillaries become more fragile. Changes in blood pressure and pulse rate are things that we need to watch for. Changes in skin color and skin temperature, such as coldness. We need to watch for complaints of dizziness and headaches, complaints of pain in the chest and/or indigestion, edema in feet and legs, and shortness of breath. Other things we need to watch for are sweating, blue tinge color to the lips or the nail beds, complaints of tingling sensations, memory lapses, lack of energy, irregular respirations, anxiety, staring, or a lack of responsiveness. So pulse is pressure of blood pushing against the wall of the arteries as the heart beats and rests. The pulse is easier to locate in arteries close to skin that can be pressed against a bone. Sites for taking a pulse: your radial pulse is at the base of your thumb. The temporal is at the side of your head. If you've ever had a really bad headache, you can usually feel your temporal pulse. Carotid is at the side of the neck. Brachial is at the inner aspect of the elbow and is usually the one we use for infants. And femoral is the inner aspect of the upper thigh at the groin. Popliteal is behind the knee. The dorsalis pedis is at the top of the foot, and the apex pulse is over the apex of the heart. The apical pulse has to be taken with a stethoscope, and you have to listen on the left side of the chest, typically where the left nipple of the left breast would be located. Factors that affect pulse are age, sex, position of the body, drugs, medical drugs, illness, emotions, activity level, temperature, and physical training. So the measurement of pulse. Normal pulse range and characteristics. Normal range is 60 to 100 beats per minute, and the pulse feels regular. That means you have very clear beat, beat, beat. Documenting a pulse rate should be noted as a number of beats per minute, and the rhythm needs to say whether it was regular or irregular, and the volume of the pulse as either strong, weak, thready, or bounding. So R in vital signs are respirations. So measuring respirations is a way to check on the respiratory system. The respiratory system, respiration means to breathe in oxygen and out carbon dioxide. Exchange of oxygen and carbon dioxide are necessary for life. The process is external respiration is oxygen and carbon dioxide exchange between the lungs and the blood. Internal respiration is oxygen and carbon dioxide exchange between the bloodstream and the cells. So the structures of the respiratory system is the oral cavity, also called the mouth, the pharynx, called the throat, the larynx, called the voice box, the trachea, which we call the windpipe, the bronchi, we have two, which are right and left. The bronchioles are the smallest branches of the bronchi. Alveoli are the air sacs covered with capillaries. The nose is lined with mucous membranes, and air is filtered by the cilia, which is tiny little hairs in the nose. The mucous membrane warms and moistens air. When we think about the lungs, the right side has 3 lobes, and the left side has 2. The left side of the lung, the left lung, is displaced by the heart, which fits right there. The pleura is the membrane that encloses the lungs. The diaphragm is the muscle that separates the chest and the abdomen. Contraction of the diaphragm draws air into the lungs, while relaxation forces air out of the lungs. So some of the common disorders of the respiratory system: a URI, which is an upper respiratory infection, includes infection of the nose, the throat, the larynx, and the trachea. Pneumonia, which is inflammation or infection of the lungs. Emphysema, or chronic obstructive pulmonary disease. The alveoli become stretched and stiff, which allows there is not adequate exchange of oxygen and carbon dioxide. Asthma, which is a spasm of the bronchial tube walls, which cause narrowing of air passages due to allergies. An allergy, which is a reaction to substances that leads to slight or severe response by the body. Influenza, which is the flu, which is a contagious form of an upper respiratory infection. Pleurisy is inflammation of the pleura surrounding the lungs. Bronchitis is inflammation of the bronchi. Lung cancer is malignant tumors in the lungs that destroy healthy tissue. So other changes that we find in the respiratory system due to aging is the lung tissue becomes less elastic, respiratory muscles get weak, the number of alveoli decrease, respirations increase, voice is pitched higher and weaker due to changes in the larynx or the voice box, the chest wall and structures become more rigid. So things that we need to watch for are the rate and rhythm of respirations, the amount of respiratory secretions and what they look like, character of cough, changes in skin color, it can be pale or bluish gray, temperature changes, and difficulty breathing. Color of sputum, which is your spit, complaints of pain in the chest, back, or the sides, shortness of breath, noisy respirations, sneezing, gasping for breath, and anxiety. As we measure respirations, a respiration is the process of taking in oxygen and expelling carbon dioxide from the lungs and the respiratory tract. And factors that can affect the rate are age, activity level, position of the body, drugs, medications, sex, male or female, illness, emotions, and temperature. The qualities of normal respirations: the range is 12 to 20 respirations per minute. They're usually quiet, effortless, and regular. When you document respiratory rate, it's noted as the number of inhalations and exhalations per minute. 1 inhalation and 1 exhalation equals 1 respiration. The rhythm is regular or irregular, and the character is shallow, deep, labored, or normal. So let's talk about blood pressure. So blood pressure is measuring the pulse is of course another way to measure the blood pressure is a way to check the circulatory system. So blood pressure is the force of blood pushing against walls of arteries. Systolic pressure, which is the top number, is the greatest force exerted when the heart contracts. Diastolic pressure, or diastole, is the least force exerted as the heart relaxes. So factors that can influence your blood pressure are, of course, weight, sleep, your age, your emotional state, whether you're male or female, hereditary, is there a family history of blood pressure problems, the viscosity or the thickness or thinness of your blood, illness and disease. Things that you will need: a sphygmanometer, which is for manual blood pressure. The cuff is different sizes, and the pressure has a control bulb. The pressure gauged is marked with numbers. They can be aneroid or mercury. You have to have a stethoscope to magnify sound, and it has to have a diaphragm. So normal blood pressure is considered to be 120 or less, or over 80 or less. Pre-hypertension stage is 120 to 139 systolic, over 80 to 89 diastolic. Hypertension stage 1 is 140 to 159, and diastolic 90 to 99. Hypertension stage 2 is greater than 160, and the diastolic number, the bottom number, is greater than 100. You need to know these ranges. If you go to CVS and you put your arm in the machine, and the machine says you have a blood pressure of 142 over 94, are you considered hypertension stage 1? The answer to that is no. A diagnosis of hypertension happens over multiple repeated checks of blood pressure. So guidelines for measurement of blood pressure: measure on the upper arm. You need to make sure that you have the right size cuff. You have to identify the brachial artery for correct placement of your stethoscope. Positioning of the stethoscope diaphragm directly over the brachial artery increases the ability to hear the systolic and diastolic sounds. So the first sound that you hear when you release the pressure in the cuff is considered systolic pressure. The last sound you hear, or a change in the noise, is considered the diastolic pressure. So if this was the blood pressure, 120 is where you started to hear a sound, which means the muscle is squeezing. Diastolic, the bottom number of 80, is where you don't hear sound anymore, and the heart muscle doesn't work during diastole. The number is written down under the systolic number, so the blood pressure would be 120 over 80. So you have to record systolic over diastolic, and you may be required to know if the resident is in a relaxed position, sitting or lying down. Blood pressure is usually taken in the left arm because the heart is on the left side. Do not measure blood pressure in an arm with an IV, an AV shunt for dialysis, a cast, a wound, or a sore. Apply the cuff to the bare upper arm and not over clothing. Keep the room quiet so you can actually hear. The sphygmanometer must be clearly visible. The large lines on the sphygmanometer are in increments of 10. The shorter lines are in increments of 2. So you always read closest to the larger line. Measuring height and weight. So residents' weight compared with the height gives information about their nutritional status and potential changes in medical condition. So baseline measurement obtained on admission has to be done and it has to be accurate. Other measurements are also obtained as ordered. Height measurements can be done in feet, inches, centimeters. Weight measurements can be done in pounds, ounces, and kilograms. So 1 pound equals 2.2 kilograms. So reasons for obtaining weight and height: it's an indicator of nutritional status, indicator of change in medical condition, and it is used by physicians in their ordering of medications. Lots of medications are based upon weight. Residents who are contractured who have contractures or special cases for height and weight, those who cannot stand, and those that must be measured using a tape measure such as a baby. When you weigh someone, use the same scale each time if you can. That's best practice. Have the resident void, which means go to the bathroom, remove their shoes and outer clothing, and it's best practice to weigh at the same time of every day. The scales remain more accurate if they're moved as little as possible. There's various types of scales, like a bathroom scale, a standing scale, scales attached to hydraulic lifts, wheelchair scales, and bed scales. And this concludes understanding vital signs, height, and weight measurement skills.